And so again, you know, this is now part of what we all, I mean, many people know, but when you took people who weren't even involved in the chemical industry or didn't work in industry, and they tested them for 210 chemicals, 167 of them were found in at least one of the people, with an average number of chemicals found per person was as high as 91. And most of the chemicals didn't even exist 20 years ago. So in a recent published study by the Environmental Working Group, and this is a great website to look at if you have an interest in this, of how people are approaching this and trying to understand it. The cord blood of 10 newborn babies was tested. 287 chemicals were detected, all of which are linked to cancer, developmental problems, or nervous system damage. And interestingly, you know, most of us here are sort of, I don't want to say beyond help, but the impact of this talk should be on your children and grandchildren, because if we could understand how to reduce the toxic burden of a woman thinking of having a family, it would have a much bigger impact on long-term health of our society than us. I mean, we've gotten pretty far with the load that we carry, but what I'm trying to point out is that for a lot of the young women, they don't think about it, and when I see them, which usually my patients are now beyond that age, I don't like to bring it up because I don't want to scare them during their pregnancy, so leave it alone. But if you have grandchildren and whatnot, and there's a thought about these issues, then there might be a way to bring it to their attention in a way that wasn't stressful to them. Next. Teflon, implicated as a causative factor in elevated cholesterol and increased coronary artery disease. Scotch guide, Vortex, the things that we're all used to can have some subtle and adverse effects on the susceptible ones of us. Next. Perfluorochlorines have been found in 90% of the people tested in the United States, and a similar percentage of people in Korea, China, India, and Japan. 17 of 18 species of animals tested positive. Next. In the 2001 issue of Atmospheric Environment, researchers reported that levels of dimethylmercury from landfills was higher by a factor of 30 or 40 than concentrations of total mercury in the ambient air. They also reported that the dimethylmercury concentration was 1,000 times greater than any measurement ever. Next. Toxic effects for the neuroendocrine system. According to the chemical industry, the major phthalates in commerce today produced by members of the phthalate esters panel do not interfere with estrogen androgen receptors when tested in laboratory animals. Much of the existing literature on phthalates focuses on an old approach to toxicology, which is that high level of exposure looking for cancer endpoints. But it's old science, and it's convenient for big industry because it makes them look like they're not doing anything bad. But it's not the best science. Next. Phthalates increase the formation of quinolinic acid. A quinolate can induce hippocampal and neuronal damage. The hippocampus is the locus of short-term memory. So again, in the susceptible numbers of us with phthalate exposure, it may be a contributing factor to dementia and Alzheimer's disease and depression. Next. I want to skip these because I have a lot of other things, and this isn't as clear as I'd like it to be. Next. So then, and there's mycotoxins from fungi, staph alpha toxins, mushrooms, heavy metals. All of these things can play some role in the susceptible individual. And I think the hardest thing for me has been how to address these issues without, in a way that produced a meaningful value to people. That is to say, it wasn't profoundly expensive, and it led to a reasonable course of therapy that produced an improved outcome. And I have to say, even after looking at it for quite a while, sometimes it's quite difficult. But particularly with the mycotoxins from the fungi, avoidance is the key. And so if you think a person has that problem, identifying the source in their home or workplace is very important. Next. And the petrochemicals are disruptors of the endocrine, of the citric acid cycle, which is really the major way we make energy efficiently. And there's evidence now that it can create, it can contribute to weight gain, and it's they're endocrine disruptors. Next. So they took laboratory animals undergoing toxicity testing and showed decreased body temperatures, and that researchers believe that the movement towards hypothermia may be a protective device used by the body to slow down the effects of toxins. And they really thought that maybe, in fact, toxic burden may have an adverse effect on efficient energy production, and therefore support weight gain and make it more difficult for some people to lose weight. And one of the interesting things is that when you're losing weight, you know, the adipose tissue is the dominant place where toxic materials is stored, so that when you're losing weight and breaking down the adipose tissue, there's a release of that material. And in a subgroup of people, it really does make them feel ill and might interfere with the effectiveness of their weight loss. Next. And the 2004 International Journal of Obesity, pollution seems to be a new factor affecting the control of thermogenesis, which is the subtle control of baseline body temperature. And I keep trying to identify simplistic ways of understanding it and documenting it for people. We do the indirect calorimetry, which measures resting energy expenditure against what would be normal for people, and that sometimes is helpful. Next. This study found that metabolic rates slowed the proportion to concentration of organochlorines more so than in the concentration of leptin, which is a hormone we make to affect weight control. There were two mechanisms proposed. The first was the effect of the thyroid by these toxins, on the thyroid by the toxins, and the second was the effect on the efficiency of energy production at the level of the mitochondria, which are the little organelles within our cells that make energy efficiently. They basically, again, believe that these products can make it harder to control body weight. Next. So I was going to move now on to this theme of cancer. And this is from the New England Journal of Medicine. This month it came out. I just happened to notice it this week, so I decided to try to put it into this talk. This is really an editorial type of thing from a writer who is, you know, a scientist, and he's referring to the President's Cancer Panel, which issued a report in 2010 emphasizing the need for stronger regulation to control Americans' exposure to toxins. And New England Journal is really one of the most prestigious medical journals in the world. Next. So the panel delivered a forceful message about the environmentally induced cancers and the lack of testing data on many chemicals in use or in products on the U.S. market. Bisphenol A found in hard plastics, 2-methylnaphthalene, which is a contaminant in cereal packaging, benzenes, asbestos, formaldehydes are all known or suspected carcinogens. Next. 41% of Americans will develop some form of cancer in their lifetime, and in fairness, much of that is the non-melanoma skin cancer, the basal cell carcinoma. Although, you know, I am always reminded that Jerry Steinfeld's show where he didn't think the dermatologist was a serious doctor until his patient came up to them and said, you know, you cured my cancer. But even with this, and we don't think of basal cell carcinoma as particularly harmful, although occasionally it can kill, but 20% or 1/5 of all Americans will die of cancer.